We're back with Real Men Wear Gowns, our campaign to get guys to take their health seriously. Put on that hospital gown, get checked, get scanned, get proactive. Today we're focusing on a condition that affects millions of Americans. We're talking about COPD, a lung condition that makes it hard to breathe and can really impact quality of life. Here's my conversation with Dr. Faisal Khan with Franciscan Health. What is COPD for those who may not be familiar with it?
So COPD is a lung disease that by definition means chronic obstructive pulmonary disease. So by the name, as you can imagine, chronic means it's a long-term disease. Obstructive means it causes obstruction or restriction of the airflows to the lung. And it's a pulmonary disease, a lung disease. So that's chronic obstructive pulmonary disease. It's from smoking majority of the time. There are other risk factors too, but basically what happens is that there's narrowing of the air tubes that deliver the air to the lung, and that then manifests as symptoms like cough, shortness of breath, wheezing, tightness, phlegm production, and all that.
How common is COPD, especially among smokers?
So currently the prevalence is in the United States anywhere between 10 to 14%. So you can imagine 1 out of 10 individuals have it. Now, not everyone is symptomatic, but being the smoking being the number one reason for it, especially in the generation that's above 50 right now, the smoking prevalence rate was higher than the younger demographics. So that is now manifesting as COPD. That's why the number is about 10 to 14%.
We've heard that this develops slowly over time. What are some of the early symptoms to watch out for?
Yeah, so as people smoke or as they go through certain occupations, the damage is happening, but there's a lot of reserve on the lung. So the people may not get symptoms till they start feeling subtle symptoms and signs like cough, persistent cough, more phlegm production, chest tightness or wheezing. And then folks may notice that their level of activity or stamina is not the same, and they get breathless more quicker with the same amount of activity they were used to be able to do. So those are the few subtle early signs. And then as the disease progresses, then basically there are two dominant categories of symptoms. If the air tubes are primarily involved, then those will be manifested more as cough with a lot of phlegm production and wheezing, tightness in the chest. And then if it's primarily emphysema, which basically means the destruction of the lung tissue itself, then that manifests as decreased stamina and just shortness of breath with minimal exertion. And they may not have a lot of cough and congestion, but just merely short of breath.
If someone notices those symptoms, what should they do?
So number one is to go and talk to your physician, because these symptoms are not only specific to lung disorder. You can have similar symptoms in asthma, you can have similar symptoms in heart disease or blood disorders. So the first thing would be go and talk about your symptoms, and what the physician would do, and any primary care physician will be well versed in dealing with it, is that they will assess your history, your risk factor, your exposure, the quality and nature of your symptoms, and they probably will subject you to a breathing test called pulmonary function test, and that assesses the airflow through the lungs, the lung capacity, and the efficiency of lung oxygen exchange. And then they may want to, depending on the symptoms, do a chest X-ray or other workup, but that's kind of the first go-to.
How is it treated or managed?
So the management depends on different categories. So number one, if you're a smoker, there will be discussion about quitting smoking, because that is the key insider. The second is symptom control. So in that category, there are a lot of different types of inhalers. Some inhalers are more towards causing dilation or relaxation of the air tubes to improve the air delivery, and some will have a medicine component that will reduce the inflammation in the airways. So there's that category. Then there are long-acting inhalers that are more for maintenance, and rescue inhalers. So it's very imperative that people are educated about the proper use of them and all that. Then going forward, there is also a role of what we call pulmonary rehab, which is basically focusing certain exercises on certain groups of muscles in the body to help minimize rate of flare-ups and improve stamina, and also have a psychological impact, because many people with COPD have psychosocial issues like anxiety and depression because of the constant struggle to breathe and some of the inflammatory molecules that get generated in the lung that can impact your appetite, your mood. So the pulmonary rehab helps not only physically train your breathing, but also it helps in those aspects as well. So depending on the severity of the symptoms, and then the third strategy is to reduce the ongoing damage and the flare-up frequency. So because many people with COPD will have, especially around when the seasons are changing and the viral infections are prevalent, will get a sudden attack of increased symptoms. So the prevention involves, again, smoking cessation, making sure you're immunized against the common pathogens, and also prevention of wearing masks and those things, that if you're around a population that is sick or if you're traveling, be mindful of your lung condition and avoid those infections.
And it's really important to manage it because it's not reversible, right? Once
the damage is done, majority of it is not reversible. If someone is an active smoker and quits smoking, they can reduce the rate of decline of the lung function going forward. So that does add to the life expectancy. So it's never too late to quit smoking or talk about cessation. And many individuals will have tried once or twice and they get discouraged. The message I want to give is it's never too late, and an average person who ends up quitting, it's very common for them to have multiple attempts before they eventually quit. So if you are someone who has tried and failed, don't be discouraged, because you're not the only one. It's a very common experience, but eventually, as long as there's a will, you'll get to it.
Dr. Faisal Khan, thanks for your time.
Yeah, you're welcome. Thank you.